electrical activity of the heart. So this is electrical activity of the heart. We are going to discuss about our action potentials. We are going to discuss about the action potentials. So whenever the cell is at rest, most of the cell are negatively inside charge. So what will happen? This negativity is there. So whenever an impulse comes and strikes it, suppose there is an impulse which is coming and striking it, what is going to happen? This negative charge is going to be converted to a positive charge. So what is this phenomena called as? Whatever polarization was there, now we are changing the polarization. That is called as depolarization. Depolarization. So how depolarization can happen? Depolarization can happen whenever there is an entry of a positive ion inside the cell. Inside the cell, if positive ions are going, then obviously depolarization will happen. Then the another phenomena which is reversing back. Suppose from the positivity, if it is reversed back to the original state, it is called as repolarization. It is called as repolarization. Why we need this repolarization? To bring back the cell to the original state. So that is called repolarization. How repolarization can happen? Repolarization can happen whenever there is negative charge entry or the positive charge is moving out. If the positive charges are moving out, like potassium is moving out, then also the repolarization can happen. So both this repolarization term, we will be constantly using it in the action potential discussion. So coming to the action potential discussion, the action potential in cardiac system, there are two types of action potential. One is the fast type action potential, another one is the slow type action potential. This fast type action potential is present in two places, that is the myocardium and the Purkinje fibers. The myocardium and the Purkinje fibers. Whereas slow type action potential is present in the AV node and SA node. AV node and SA node. The RMP of all of them are different. For a myocardium, it is under minus 90 millivolt. For a Purkinje fiber, the RMP is minus 80 millivolt. For an AV node, it is around minus 60 millivolt. And for the SA node, it is minus 50. This is one more reason why the SA node is spontaneously firing comparatively more with respect to the other fibers, because the RMP is already towards the more positivity. So let's start our discussion with the fast type action potential. We have to know what is the reason for all the events that is happening in the action potential. So coming to the fast type action potential, this is the classical diagram of a fast type action potential. Whenever any graph is given, what is the first rule that we have to follow? We have to see what is there in the x-axis and what is there in the y-axis. So along the x-axis, we have the time period in milliseconds. Along the y-axis, there is voltage. So what is the RMP in case of fast type action potential myocardial cells? It is around minus 90. That's why we have started it from here. So from minus 90, what is happening? Just see, there is an upstroke. This upstroke is bringing it towards the positivity of plus 35. If this upstroke is there, it means that some positive ions are entering. So whenever I told you, whenever positive ions are entering the cell, what is that polarization? Initially it was in negative, now it is becoming positive. What is this funda called as? That 0 here is, it is called as depolarization. We will write down all the events. 0 is depolarization. Then after that, there is falling of potential. As you can see here, this one, there is falling of potential. This is called as repolarization, but there is another proper repolarization also. The another proper repolarization happens in 3. Can you see it here? It is another proper repolarization which is happening. So the first part is called as transient rapid repolarization, whereas 3 is called as repolarization proper. And between 1 and 3, there is a plateau phase. As you can see here, there is a plateau phase. This phase is called as plateau phase. And finally, what happens in 4 is, it is bringing back the cell to the RMP. 4 is like, it is bringing back to the cell to the RMP. So maintaining the RMP. So now let's discuss about the individual phases and what are the ions responsible for it. So we have to keep this diagram in mind. So what is the phase 0? The phase 0 is nothing but a depolarization, that is the upward deflection. What is due to the upward deflection? In a cardiac myocardium, you just remember myocardium or the Purkinje cell, the ionic basis for this is entry of sodium ions. This is exactly opposite in case of a slow type action potential, which we will see in some times. So this voltage gated sodium ion, the entry of voltage gated sodium ion channel, sodium channel is responsible for the depolarization. What is the one event? There is a rapid repolarization. This is called as transient, because it is not repolarizing till the last. Transient rapid repolarization. And I told you repolarization can happen because of the exit of positive ions, and the most common positive ion exited is potassium. So this transient repolarization is due to potassium moving out. And not only that, there is another reason also, because now the sodium channels are closed. Sodium channel closed. But the primary reason, both of them are the reasons, but the primary reason is potassium moving out. The primary reason for transient repolarization is potassium moving out. Now coming to the second phase where we saw a plateau in the curve. This is the plateau in the curve. So this plateau phase. So there is a plateau. Plateau means, what does it mean? It is staying at the same potential. So what does it mean? Some of the positive ions are entering, some of the positive ions are exiting. So which was the positive ion already exiting? That is potassium. But what is the positive ion that is entering? The entering happens in the calcium. So there is a potassium exit, which is one reason. Then at the same time, there is a calcium entry. So as and when any type of calcium entry is there, what is going to, this is the action potential we are talking. But what will be the event that is happening whenever there is availability of calcium? Which event will happen? The event called muscle contraction. The calcium is available. So obviously this will cause muscle contraction. So this muscle contraction, if they ask you it happens in which phase, it usually happens or starts in the plateau phase because of the entry of calcium ions. Because calcium ions is very, very essential for the actin-myosin interaction, which we will be studying in the muscle physiology. Now coming to the third phase, it is the repolarization phase. This is the proper repolarization phase. And what is the reason? The potassium channels are still moving out. The potassium channels are still moving out. At the same time, the calcium entry has been stopped. There is stoppage of calcium entry. So both are reason, but the primary reason is potassium exit. Now coming to the last phase, that is the RMP. Now who is bringing back this RMP? Because whenever potassium channels are opening, they are very slow to close. What will happen? More and more potassium will go out and they can cause a hyperpolarization. Who will correct it? Who will bring the potassium inside back? It is our famous channels, that is the sodium potassium ATPase channel. This we have clearly discussed in the muscle physiology. What is the RMP? Who is contributing it? But sodium potassium is maintaining the RMP. It is not creating it, it is maintaining the RMP. So the RMP is maintained by this. And one more important thing before finishing it, what happens? The calcium is released from the sarcoplasmic reticulum. The contraction is happening. This calcium, whichever is released, they have to be taken back into the sarcoplasmic reticulum, the excess calcium that is released. So it is done with the help of two pumps. The first pump is called as SERCA, that is sarcoendoplasmic reticulum calcium ATPase pump. It will directly put the calcium back into the sarcoplasmic reticulum. And there is a second channel which is clinically also important. That channel is called as NCX. What is this NCX? It is nothing but the sodium calcium exchanger. Sodium calcium exchanger. And this sodium calcium exchanger will try to put back the calcium inside the sarcoplasmic reticulum. But this is a secondary active transport. They always need the help of another channel, that is the sodium potassium ATPase channel. So what it will do is it will throw out the it will take this sodium potassium exchanger is putting the sodium inside, which can be thrown out outside with the help of sodium potassium ATPase, and this cycle is constantly kept. There is a drug called as digoxin. There is close relationship between digoxin and this diagram. What digoxin does? All of us know digoxin increases the cardiac contractility. So contractility of the heart is increased. Most of the people think that it is directly acting on the calcium channel. It is not. What it does is it blocks the sodium potassium ATPase. How does blocking sodium potassium ATPase help? Let's see the diagram. Suppose you block this channel. Now what will happen? More and more sodium intake will not happen because sodium is not thrown. So whatever the sodium which is come here, that will be stopped. So the calcium reuptake will also be stopped. This calcium will stay in its own place. It is not going back into the sarcoplasmic reticulum, because as and when more and more calcium is replenished or taken up into the cycle, or this pump is going to be active. Now what will happen? This pump is blocked. So ultimately this pump also will stop acting because it is dependent on that. Then what happens to the calcium? The calcium will be available for a little longer time. So if the calcium is available for a longer time or more calcium is available, what is going to happen? There will be an increase in cardiac contractility. But the primary function of digoxin is to block the sodium potassium ATPase, and it does not, and it indirectly affects the sodium calcium exchanger. So this can be a MCQ. What is the mechanism of action of digoxin? Now coming to the slow type action potential. This is the classical diagram of slow type action potential. As you can see here, the comparison between it, this diagram we have put it here to compare it. This is the fast type action potential which had various phases 0, 1, 2, 3, 4. Let's see and compare the same diagram. So this maintaining of the RMP is seen here also. So what is this phase? This phase is nothing but a phase 4. It is a little different from the fast action potential. It is phase 4. And what is the RMP here? Minus 65 we have written because SA node is between minus 65 to minus 50. It is in a fluctuating RMP. Then what is this upstroke? The upstroke stage is our 0. Do you see any transient repolarization? No. Do you see a platyphase? No. So phase 1 and 2 are absent, and finally there is a rapid repolarization, the repolarization which is Z3. So phase 1 and 2 are absent in case of a slow type action potential. Now we have to know the ionic basis of it also. There is one difference which is very important. For example, the 4 event is for the maintaining the RMP. It is nothing but the RMP. Here the RMP has a special name. It is also called as pacemaker potential. Pacemaker potential. And it is also has another name which is called as pre-potential. So all these are names of the RMP which is generating. In RMP, what is happening? There should be an entry of some of the ions. So then only they can reach the threshold. What ions enter during the RMP in the cardiac muscle, like the SA node? The sodium enters, potassium enters, and calcium. All of them can enter. All of the channels are available in the SA node. That's why it is making a predominant pacemaker. This sodium channel has a very special name which is called as HCN. What is this HCN? It is nothing but the hyperpolarization activated. This is a very long name. Cyclic AMP nucleotide channel. Nucleotide channel. So this is the name of the entire channel, and it is also called as funny channel. This is also called as funny channel. Why it is called funny channels? Because there are only few channels which can get activated because of hyperpolarization. Usually depolarization or repolarization will open the channel. Usually hyperpolarization inactivates most of the channels. But these channels, whenever the potential goes for hyperpolarization, for example in the previous diagram, so whenever the potential is going for an hyperpolarization state, what will happen? These channels will activate it and bring it back to the potential above. So they will keep on doing it and bringing the pre-potential to the threshold levels. So this type of hyperpolarization activated channels are present in the SA node, and some of them are responsible for the taste sensation also, like the sour taste. In special senses, sour taste is done with the help of this HCN channels. Then coming to the phase 0, this phase 0 is nothing but a depolarization. And what is the reason for depolarization? Most of the students answer it wrongly because they say it is sodium. Sodium is for the fast type action potential, but here the channel required is calcium. There is entry of calcium inside the cell which is causing the depolarization. So the answer here is calcium channel for the SA node. Calcium channel for the SA node. Then what is phase 3? The phase 3 is repolarization. Repolarization. What is the repolarization? Here the channel is same, that is the potassium channel. Potassium channel, the potassium which is moving out. The positive ions are moving out, so it is causing a repolarization. So there are only phase 4, 0 and 3, and phase 1 and 2 are absent in case of slow type action potential. Then coming to the sympathetic stimulation, all of us know heart is under the control of sympathetic stimulation and parasympathetic stimulation. Sympathetic stimulation increases the heart rate and parasympathetic stimulation decreases the heart rate. All of us know this concept. So how does it act? This sympathetic stimulation, like the adrenaline and noradrenaline, what they do is they will open up or increase the activity of funny channels. They are constantly increasing the activity of funny channels. So whenever they increase the activity of them, what will happen? The slope is going to increase. For example, the flat slope like this will be increased to this much. So what is going to happen? There will be an easy reach of threshold. The threshold reach will be much faster. So what will happen? The cycle is like going like this. The black ones are the new cycle. The black ones see here, the second cycle has started much earlier. So what will happen to the increased rate? The heart rate is going to get increased. So this type of stimulation happens because there is an increase in slope and increase in pre-potential, finally increasing the heart rate. Parasympathetic, what it is going to do? It is going to flatline the slope. It is going to decrease the slope and finally reduce the heart rate. They are primarily acting on the pre-potentials and pacemaker potential. That's how they are controlling the heart rate.